Here at this conference, I was able to speak to home collected samples and how we can ensure quality of home collected samples for our patients. So, for example, cervical cancer screening. Does a patron need to have to go to their doctor's office in order to see whether or not they have HPV? In fact, they may not. And so, some of the work that I'm showing is how you can collect a dry swab at home for cervical cancer screening, and that can come to the lab, and we can have quality processes to tell you whether or not you're at risk for cervical cancer screening based on that HPV result. There's other screening that can be done from home, like for CKD. Chronic kidney disease is another one where we can look at creatinine and urine albumin to creatinine ratio. Both of those samples can be collected from home and can come into the laboratory via a postal service if we have appropriate quality metrics to ensure that all of our testing is covering the aspects of quality management for home collection of samples. Basically, it's more about how do we design a test menu that is appropriate for home collection. So what is clinically indicated to be tested from home? What don't we need for acute care? And then how can we ensure that the analyte that we're collecting from home is stable and that the collection process is okay for the person that is doing the collection. So, for example, with cervical cancer screening, we want to make sure that the swab that is collected, that HPV doesn't degrade when it's being transferred from the patient's home to the laboratory. We want to make sure that we get accurate results for that. We have shown that with the methods that we've developed, home sampling for HPV is a very valid option. It's done in many countries outside of the US, and this is really for US-centric regulatory bodies in order to make it appropriate and show that the analytical robustness is equivalent to the clinical robustness that folks have seen outside of the United States.